Hi guys, welcome back. This week I am so grateful for health because my daughter has brought back a few upper viral infections which she has shared around so lovingly and we just seem to be catching them, and anywho, we're on the mend. So I'm super grateful for health. Either way, we will be chatting about head injuries in children this week. And I think it was nicely timed, of course, because Sunday was a Super Bowl Sunday. It popped into my head to discuss this particular topic because my daughter is at the age where she's very active and she's just running into things, jumping off things. She loves testing her limits. And of course, we're always nursing one injury or the other. So I thought it would be a nice thing to talk about this week. So grab a pen and paper, grab some coffee or tea, and let's dig in. Now, before we jump into our topic for this week, I have a bit of a surprise for you guys. We have a special guest coming on next week, and I'll drop a few hints throughout this video, and I may or may not tell you who it's going to be by the end. Stay tuned and find out. But anywho, yes, special guests coming on next week, and we will be chatting about, I haven't quite decided yet. I'll see, I'll let her pick. Oh, now you know it's a female. I'll let her pick what she wants to talk about. But back to this week, head injuries in children. So it's unfortunate that it happens, but it does happen. And you have probably about 200,000 cases, up to 200,000 cases a year. That account for ED visits, hospital admissions, and workups just because of trauma to children's heads. Now, why this is so important to talk about is because there is no effective treatment for brain cell or nerve damage. Everything we do is supportive in its management to sort of decrease the work that the cells do, or remove bleeding around it, or manage seizures, stuff like that. So a lot of the treatments that we do now are supportive, but there's not an actual treatment that can actually reverse the damage to the brain cells or nerve cells if they've occurred and restore function. So because we don't have this treatment, prevention is utmost, right? So in trying to prevent brain injuries from occurring, information is power, knowledge is power. Hence this discussion. Let's keep our children safe. Let's talk about how to prevent them and manage them when they do have brain injuries. So what is a brain injury? A traumatic brain injury. It's literally injury that occurs to the brain from trauma. That's as simple in its definition. It can be accidental, meaning it occurred by accident, or non-accidental, meaning it was intentionally inflicted. And those are really sad. Those are child abuse cases. So talking about both of them, both accidental and non-accidental, however they came about, the management path is pretty similar, except that with non-accidental trauma, of course, you have CPS involved and all that, which is necessary. So who's at risk? All children are at risk for traumatic brain injury. The risk for non-accidental trauma in the everyday household, it peaks actually in the early childhood period. The risk for vehicular trauma peaks in mid to late adolescence, and that makes sense, right? They've just gotten their driver's license. They're out in the world exploring and testing their limits again. Children under 1 year of age, if injury occurs to the brain at that time, it's most likely to be intentionally inflicted, which is a shame. Case in point is shaken baby syndrome. And we'll talk about how they look like once it has occurred. Now, what is the mechanism of injury? How does a force or trauma affect the brain? So you could have trauma that is directly inflicted, like a blow to the head, a bat hits the head, or a ball hits the head during a game, or a baby falls from a height, something that directly hits. So at that site of where the impact is received, the brain cells there are injured or damaged or inflicted. So that would be there's a word for it in French, or phrase that we use in medicine, which is a French phrase, coup and contre-coup. So coup is the injury and contre-coup is the indirect force of it. So that force that causes the direct injury here also causes the brain to shift, and because there's fluid around the brain, as it bounces back off the bone on the opposite side from where the trauma was, the brain cells around that side hit the bone with increased force, or the force they've received, and cause injury to that side as well. So indirectly, that part of the brain also suffers injury. So that's sort of the basic mechanism of injury, and the other things that play into that as well, how well the brain is perfused or receiving blood and all that good stuff. But at its most basic, that's the mechanism of injury. What does brain injury look like? So if you have you can have some very, very mild or just superficial physical signs like a bump or a bruise or a cut, and there's bleeding, but child is otherwise, normal and active and playing. Or you could have, symptoms of a concussion, headache, nausea, vomiting. They're a little confused. Concussions could be mild or severe. For the most part, concussions don't have any long-term effect if it was just the one concussion, but repeated concussions, especially back-to-back, can have long-term brain damage as well as long-term loss of function. So that is important to know. The other way it could present is you could actually have part of the bone being broken, it's called a skull fracture. And if that fracture stays where it's supposed to be, the bones stay in the same plane as where they were before the injury, it's called a non-depressed skull fracture. Now, if any of those pieces of bone move out of the plane in which they were prior, it's called a depressed skull fracture, and those pieces can cause injury. So those pieces can actually injure the brain directly where it's at, or it can cause any of the blood vessels around there to tear and bleed. And therein lies the highest risk with brain injuries, is if one of those vessels that it touches is an artery and it causes it to bleed. Because the brain is a finite space, there's not a lot of movement. If blood is bleeding into that space, it's causing increased pressure and hence compressing on the brain, and none of that is good. So bleeds in the brain is another way that brain injuries can present. And the bleeds in the brain can be acute, meaning happen very fast. Those are the epidural hematomas. The blood collects between the bone and the outermost covering of the brain, and those ones occur, the bleed occurs fast and the accumulation occurs fast, and the symptoms you'll see will progress quickly. Versus a slower bleed called a subdural hematoma, this blood just accumulates between the coverings of the brain, and it's a vein that's bleeding, so it's a slower bleed, and it can actually happen over days, weeks, and sometimes even months. So the symptoms you will see will be sort of coming on really slowly. So these are things to just keep in the back of your mind. And the symptoms you will see, because it's all brain that we're dealing with, they're mostly similar. It's just how quickly or how slowly they're occurring that makes you want to act rapidly, or at least makes you think about it early or later. So what are these symptoms? Again, nausea, vomiting, change in gait or confusion, can't really remember things, sleepy, more drowsy, more irritable, irrational behavior, they're just not themselves, they've lost their appetite, things like that, loss of function, they can't move a hand or a leg or things like that. So all these symptoms are similar across board for brain injury for the most part. They've become more specific depending on what area of the brain was affected. But the rapidity or with which they present themselves will sort of give us an idea of which one we're dealing with versus the other. Regardless of what is causing it, you should present to your provider, either the emergency room, or call your physician, and they will walk you through the steps that need to happen. First of all, and we won't really go into it because this is not really a medical discussion per se. The meat of it is in how we prevent these injuries from occurring. So yes, if you're seeing these things, call your provider, go to the emergency room, They will do some head imaging, do some blood work, of course do a physical exam, check eyes and all of that, and get a very detailed history from you. So it's important to remember when the injury occurred, what exactly happened, what height did the baby fall from, things like that. Those are specific things that help the providers determine how acute, how serious, how life-threatening any of this is. So I said I was going to be giving you guys hints about who's coming next week. I gave you one hint already. It's a female. And your second hint is it's a physician. And I thought it was a good thing because this week we celebrated National Female Physicians Day. So I was like, oh, that's so cool. Let's do that. Let's have another female physician come on and just chat with us. So that's your second hint. Maybe you can guess who it is by now, but we'll see. So back to our discussion, head injuries in children. These are my tips for you. And these tips, anybody who deals with children or any provider who pediatrician or works in the emergency room will tell you the same thing. My brother is an ER physician, and on his podcast, Cast of Characters, this is one of his pet peeves. So I'm reiterating this again. This one's for you, Lush. So here we go. The first thing is provide a safe space for your children, right? Safe play space. So in that area, either they're playing in the playpen, or if you want to allow them to play free, make sure that you have baby-proofed or child-proofed that area. There are no sharp edges on desks or things like that. The TVs are screwed into the wall. The cupboards are screwed into the wall. They're not through rugs that they can easily slip on and fall and hit their head. Things like that. So safe play space. The second thing is supervision is key. Make sure that you are supervising your children during play, or supervising them, especially kids under 1 year of age. Never leave them unattended on the changing table, in a car seat or in the stroller. Make sure that you're not using walkers, because they can bump into things and that can fall on them, especially if they're not screwed into the wall. Don't leave them playing a trampoline. In fact, unsupervised. In fact, don't let them play on the trampoline. It's not recommended by the AAP. Supervision is key, is the bottom line for your second tip. The third tip is protective gear is essential. I cannot say it enough. Protective gear during sports is essential. And make sure that the gear is professionally fitted. So for sports like football, baseball, ice hockey, skiing, snowboarding, skating, inline skating, rollerblading, riding a bicycle, they need a well-fitted helmet, a helmet fitted by a professional. I cannot emphasize it enough. Protective gear is essential. It will save you a whole lot of trouble. So make sure that your children are always wearing protective gear when they're playing, either professionally or just playing by them, playing recreationally. Protective gear is key. And I think those are really all my tips for you this week, guys. I don't have nothing else comes to mind. I will post the blog with all these tips also outlined in that blog. And next week we will be talking about, your last hint is we would be talking about, because she just told me, plants and children. Yeah, we'll see where that goes. Thank you for staying tuned. Thank you for listening. Thank you for always joining me. Make sure you follow me on social media. I'll put my links below. Subscribe to my YouTube channel, and I'll see you next week. Have a